dovetails a bit to that. This could be for Dr. Henry and Dr. Ballem. Does that number factor in children? How are we going to immunize both 5 to 11-year-olds once approved by Health Canada, as well as doing booster shots? Will they be done in similar locations? Do we have enough vaccine to manage both groups at the same time? Could boosters be pushed back in order to ensure children are immunized, or vice versa? How are those challenges getting grappled with as we await the timeline from Health Canada?
Yeah, the really good questions, things that we've been wrestling with and talking with our teams about over the last few weeks, and why we've taken the time to do that thinking over the last, particularly in the last 2 weeks, as we've got more and more information about the booster doses. So a couple of things. One is the vaccine supply, and what we are hearing from Health Canada and from the manufacturers about the vaccine for 5 to 11-year-olds. It will be a different formulation than what we're giving now to adults. Not only is it a smaller dose, so it is half of the, for the Pfizer vaccine, it's less than half actually, it's a 10 microgram of the antigen. It also is a completely different formulation. So we cannot just use the adult dose for children. And yes, we expect, and we've heard from the federal government, that they have got a commitment from Pfizer to have that child formulation available as soon as it's approved for use by Health Canada. In terms of how we're going to be able, in terms of the vaccine, yes, we are confident that we'll have sufficient vaccine to do both programs. In terms of how we're going to roll them out, a lot of it will be together, because we know that the parents of younger children are looking for a certain type of environment to have their children immunized, and those are the same environments where we can provide booster doses for some of the people in our communities. So in some cases, if I think of a number of our First Nations communities, they are looking at having, particularly ones where are not having ongoing transmission at the moment. Can we do a whole of community approach where we give a booster dose and also the childhood immunization at the same time? Can we also look at clinics where older people and children and families can come together to be immunized with the appropriate vaccines? So those are all things that are being worked out by our teams across the province, depending on the community and the situation in each community. I don't know if you want to add to that.
I would just... Thanks, Dr. Henry. And really just to add, we have planned to integrate the children's vaccine if it's approved and we have the vaccine available. And if we have a slower response or it's delayed, then we will be able to continue to draw in, the higher risk groups that we would be planning to continue in January. We can bring them forward. So we will plan. That's when I said a paced program. We will plan our capacity. We will send our invites aligned with that capacity. We'll be tracking it on a very, pretty much a daily basis to make sure we're able to fill our clinics and that we're getting people in the right order at the right interval.